Hello, you Guru.
Hello, madam.
Hope you're doing good.
Yes, as always.
That's nice. You Guru, we spoke about food, we spoke about water. I'm just curious. I was chatting with my friend. It happened to be that she wasn't well, and no, she took self medication.
Oh,
So this is one common thing which we hear about of late and for the past many no years. What is your stand on this, Yuguru, about self-medication? That also plays a vital role in having good health. So what do you have to say about it?
one word, madam. Dangerous.
Okay.
Just like Michael Jackson says, no? Dangerous.
Okay.
So, self medication is nothing but you are just inviting death to yourself as early as possible.
That's
First
harsh,
of all,
yeah.
yes, madam. But sometimes you have to be harsh, madam. Otherwise, no, our people don't understand.
Rightly
Okay.
said, yes.
So, first of all, medication itself is a bad thing.
Hmm.
On that, self medication is even bad. Now, what happens now, madam? Google. Two people know everything, madam. Okay, I think I've told
One is
this to-
Google,
Yes,
yeah.
one more is God.
Yeah,
So
both
God
are
and
G.
Google, yeah.
Yeah.
So God and Google know everything. So many people they can't reach God. I mean, they try to keep trying to reach Him. Okay, but they are not able to reach. Easier accessible is Google. So as soon as I get a headache, immediately go to Google.
Yeah.
Headache since 3 days, and some are very specific in that. Front side of the head, I'm having ache. So front side of the ache. Now Google, whatever you tell it, no, first thing it will tell is cancer.
Cancerous. That's
It's
right.
cancerous.
Yeah.
So as soon as say a person, a non-scientific or a non-medical background person, for just for your reference, madam, I have done my microbiology,
Okay, sir.
so I know a little bit of this. Little bit of this healthcare industry, and I
Yeah.
also worked in the healthcare industry.
Yeah, we can see that. Yeah.
So, when we talk about this medication, many people know immediately they go to Google, and Google is their doctor. Of course, in one way, no, madam, for the amount of consultation the doctors and the corporate hospitals charge, Google, many people, that is the reason why they don't want to go to the doctor.
Maybe.
Yeah, maybe. Okay, so what happens? I personally have seen many times. Generally, especially some people who are not very knowledgeable about this medication, they just go to the pharmacy and they tell, "Bhaiya thoda sir dard hai na, bhaiya thoda kuch de do na, kuch de do." Then that pharmacist, he'll not even understand what is their health condition, why that headache came, nothing. He will just see his thing, which is the drug which is not selling that much, which is tablet is not selling that much. Sometimes may be expired also. I'm not saying all of them, but some. The chances are there. Okay, so he will just see whichever the tablet is not selling that much. He'll just take and ये दो खा लो, सुबह एक खाना, शाम को एक खाना, हो जाएगा, पूरा हो जाएगा. Okay, so
It
if you
was
keep,
funny. Yeah.
yes, madam. In fact, I will give you my own example. One of my uncles, my mom's younger brother, so he was famous for this. Though many of my family, many are doctors, but he always had this habit of self-medication.
Okay.
So I'll ask him, uncle, why, uncle, what happened? You're looking so. Hey, illappa, konda talanova inchi, atta medicine pot, or tablet pot. And Chonna, uncle, in what tablet, uncle? Show me that. Na? No, it is a regular one. You don't worry. That's the regular one. I take always. I take. And if you have in his pocket, no, you see in his pocket, he'll have a sling bag always.
Okay.
So whenever I open that, no, one small pharmacy will be there. Okay, you are in face like no, like a first aid kit we have no these days.
Okay.
Those days only, no, he had a first aid kit right in his pocket.
Okay.
So that was just on the funnier side. So generally, what happens is when you self-medicate, firstly, you are already tensed. Especially, I'm talking about people who are knowledgeable that they are self-medicating, and then they get into Google, understand their condition, so-called understand. Okay, understand their condition, and then self-medicate. So this is one track. Another group of people, they don't even know anything, especially those who are not that educated or literate. They totally depend on the pharmacist.
Yeah.
So the pharmacist, whatever the drug pharmacist gives, it may be anything. Like we do in our clinical research industry, we have something called placebo effect. So whatever the pharmacy gives, whatever the pharmacist gives the person, once they take it, they'll feel comfortable. Okay, sari aitappa, theek ho gaya, chennagayitu, and they'll be happy with that. That should not be the case. What happens is, whenever you self-medicate, you are intentionally harming yourself.
Okay.
First thing, that pain, maybe say for example, the commonest thing, madam, headache. I would like to place this on record. The last headache I had was in 2016.
Oh, nice.
Okay, it will be surprising for you, madam.
Yeah.
But this is the truth. I generally don't tell lies,
Okay.
especially about health.
Okay.
So the last headache I had was in 2016.
Okay.
So that is almost going to be 10 years, probably another 2 years. So 8 years. But when I see my colleagues, when I see my friends, and when they talk about everything, ಅರೆ ತಲೆನೋವಪ್ಪ, ತಲೆನೋವಾ ಹೌದು, ಚಲಿನಾ ಹೌದು, ಕೆಮ್ಮಿಡಿನ ಹೌದು, ವಿಕ್ಸ್ ಆಕ್ಷನ್ 500 ತಗೊಂಡು. Sorry for that. So that's what is happening, because many of them, they are unable to understand why this headache has occurred. See madam, there are two things. Now scientifically speaking, the disease and the symptom. Now the headache is just a symptom. It is not the disease. Now there can be so many diseases which causes headache. How do you know what disease has affected you?
Right.
You are only treating the symptom. If you treat the symptom, it will come back. Till the disease is there, the symptom will not go.
We need
You
to
can-
check on the root. Yeah.
Exactly. Root cause analysis. Corporate guys will understand this term because they use it often in their thing. Anything goes wrong, especially their QA team or the QC team, they always go for root cause analysis. This is what now is the need of the hour.
Okay.
We should do a root cause analysis of why this headache is occurring to me frequently. Initially, madam, when I started my career, this I'm talking about 2009. When I started my career in a call center. I was working in a call center for some time. So I was working in this US shift. Okay, the entire night we used to be on calls. So suddenly, after 3 to 4 months of working, on the 5th month, I began to get a severe pain towards my head, on the right side of my head. Severe pain, unimaginable, for no reason. And I could hardly sleep. I used to sleep in the daytime only at that time, because night I used to work. I could hardly sleep. Then I realized that, okay, this is the cause of migraine. So when I went for the diagnosis, so the doctor at that time told me that this is because of migraine. So then, as you know, that migraine is one of the most common reasons for headache, right?
Exactly.
As soon as they get the headache, what did they do? They simply go pop a pill, painkillers. Painkillers are one of the most dangerous among the drugs in the sense medication, what I'm mentioning here. Among the medication, the family of various medication, painkillers are one of the most dangerous group. The more you put the painkillers into yourself, the more susceptible you will be for various kind of problems, severe problems.
True.
Which is better, madam? Having a headache for 1 hour or losing a life?
Definitely
Obviously.
the first one.
Yes. So 1 hour headache, somehow you do it and go. In
Yeah.
fact, there is one lady, one scientist lady from that article is there. You can Google it. That person's name is not coming to my mind. She has made an entire research on headache, and then finally her final analysis is, whenever a person gets headache, the most what you can say, what for the lack of word I'm using, most supportive medication is meditation.
I was just about to ask you that, you Guru, when you said like, no, is it okay to suffer for an hour or no, have a threat of life? I was just thinking about, why is there any other option which will help you to get rid of the headache instead of having it for an hour or a day? What is the way which we can handle that?
Definitely, madam.
Yeah.
I am there.
Okay.
Henceforth, don't worry.
Thank
Any
you.
headache, follow my techniques. You will 100% recover.
Oh, that's
Okay.
great. Yeah.
So this is, meditation plays a greater role in decreasing and eliminating your headache than a pill.
Okay.
Okay. There is no pill for every ill. Okay. Not
Yeah.
possible. But after you take every pill, there is a ill. Okay.
Such a
This
true
is-
statement.
Yes,
Yeah.
madam. This again one of my mentors, my YouTube mentors say, Dr. B.M. Hegde. So I thank him a lot. I listen to him a lot. So he has said this statement. So I give the credit to him, which is very, very true. Very, very true. Absolutely true. So self-medication is nothing but danger. As Michael Jackson says, it's dangerous.
Okay.
So please avoid it. There are much more things to talk about self-medication. We will talk, madam, in the coming videos.
Sure, you Guru. Thank you so much for giving an elaborate explanation on self-medication. I hope it would have been useful for many of us. So please do like, share and subscribe to this channel to know more about yourself. Thank you so much, you Guru.
Thank you, madam. Thank you. Blessings of the universe.
Thank you.